because I've also been active members on ACORN, as you know, which is the Australian College of Operating Room Nurses. We have the Queensland Perioperative Nurses Association, and I'm also the co-chair of SWAPNet, which is the statewide anaesthetic and perioperative network at the moment. So from a clinical perspective, some of the things that is an expectation when these guys walk into a theatre, and I suppose from a HR perspective, these are the sorts of things you want to be able to identify that the people are going to be able to be responsible and accountable for this sort of behaviour. So we're looking at things like, we don't want to have to worry about their ID or their accountability or their integrity. We just like to think that that's a given. We acknowledge them as a visitor, and so therefore as a visitor we want them to be respectful, and it would be great if they had this capability of finding out what the gap was and they are assisting with a solution. They don't need to take over, they don't need to run the show, because that's, I suppose, from a nursing perspective, or the people that work in that hospital, that's their home. That's what they do all day, every day. So we've had, and I say we, most nurses have had some horror stories with regards to reps and managers that they come in and they take over, and the horrible side of it is that when they finish what the part is that they wanted to do, it's drop and run. So it's easier for us, if they ask, if they have some kind of checklist, if they need to have a checklist just to keep them, I guess, organised. And just like talk to the scrub nurse and find out if they're actually a regular person, if they are regular to that hospital, regular to that service, regular to that actual operation. That's the first way to actually find out what your role ends up being in that operation. It's a partnership. And this is going to sound terrible, and I say this with tongue in cheek, seeing there's a surgeon coming, but having scrubbed for many a surgeon and been an orthopaedic scrub nurse myself for many years, it's not all about the surgeon. So when you actually come in, even though the surgeon is interested in your kit and is interested in working with that particular system, and they want it to run smoothly, the only way it's going to run smoothly is if that nurse is on board, and if you've got the confidence of that nurse. It's always good to go in early. It's always good to, watch to see how that team is running before your part takes place. Because if that's a well-oiled machine, that team, you'll know that you'll slot in a particular fashion. You'll go in there, you'll do a very small and minor part. If you see that team isn't used to working together very regularly, you'll actually see that your part needs to be a bit larger than that. It's not about taking over. It's just about all of a sudden realising there's a bigger gap than you first thought. And also just to be aware of, what the anaesthetic department or what the anaesthetic side of things is doing. It's always nice to understand how that theatre is running, and I guess the acceptance and how many other visitors are in that theatre. It makes a huge difference, because sometimes you're not the only visitor for whatever reason. Some hospitals don't always regulate how many either reps or other people are in those rooms. It's sometimes down to nursing staff, and maybe because they're nervous, they're not as vigilant, but you may actually, or those people may need to actually have that thought process in mind. I guess from a HR perspective, we're always, from a nursing perspective, working with HR, we're always about the ongoing relationship. What could that possibly look like? The after sales side of things. So it's not just about, dump and run for us. You've sold us the piece of kit, or you've done the operation with us, or you've delivered something because we didn't actually order it on time. It's about the phone calls in between to see how things are going. It's about education sessions that you offer as an after sales service. What do they look like? Are they tailored? Are they full of resources? Are your resources a little bit, what would you say? Are they a difference? Like, what's your point of difference? So those resources, we're starting to talk in the hospital situation, we're talking about podcasts, and we're talking about library of webinars and things like that, so that it's not always having to be delivered face to face, but it's also something they can go back to several times. Yes, it's nice to bring some kit in, particularly, again, seeing you've got an orthopaedic surgeon coming, there's always massive amounts of technology and, widgets and gadgets and so forth, and learning how to put those together, because 9 times out of 10, we've got to put them together at the table. So it's always nice if we can, have something to go through in our own time. remember that most of these hospitals are 7 day a week, 24 hours a day. So if they've got the option to go through these overnight or when there's downtimes, because we don't expect a rep to come in at 3 o'clock in the morning when everybody's, sitting there and thinking, what can we do next? Let's do a bit of online education, or watch a webinar about, how to put this new retractor together, or, how we actually set up the cutting jig for something. So that's really, really good. The things or the areas that a lot of reps or salespeople forget is they actually forget the other support areas like CSSD. So with our central sterilising departments, again, we have varying levels of staffing expertise, and we don't always have nursing representation down there. Sometimes it's purely technical. So those technical people, as much as they're we call them technicians or AINs, they don't often get to see how the gear is used. So it is often beneficial if there's a little bit of extra time that when they deliver the kits, that those kits can be gone through, and there's just a little bit of extra respect for them, because if they've got a lack of knowledge, it's going to take them longer to process that gear for them. The other thing is just taking the initiative, I suppose, to whenever they come in first, and sometimes even for the first few times, is to bring all those instructions for use, any TGA approvals, anything like that, because you'll find particularly the bigger hospitals are very vigilant with regards to what does that look like. We're not reprocessing anything or actually releasing it to our theatres without making sure all the checks and balances are done. They'll want to check to make sure that all their parameters of their sterilisers meet the right things before they actually release anything. And that's their responsibility and accountability. And it's really something to acknowledge, because a lot of the time when we have those, those misadventures, if you like, with regards to the surgeons and the theatre team, is because the theatre team hasn't been able to get the gear up from CSSD and the surgeon's waiting for it. So if you can actually give them the gear earlier and understand that they need to make sure that it meets temperature, pressure, that they can actually, the water, all of the things that need to be ticked off, it needs to be ticked off. I think from a HR perspective also, it'd be interesting to see, again, their point of difference. Do they have a knowledge of AS 4187, which is the Australian standard for reprocessing reusable medical devices? Because when the different parts of the world that these things are manufactured, they actually have different parameters. So if the rep or if the sales manager had an understanding of that standard, then they'll actually be able to speak the same language as the CSSD, as the theatre team, because nobody's going to allow anything to be used on a patient, because everybody's there to advocate for patient safety. And if there's any doubt, as we all know, sterility is absolute. So if there's any doubt to that, it won't be released. And then all of a sudden you'll end up with a big problem on your hands, because the patient will be delayed, surgeon will be unhappy, and everything will go to poo. Everyone will be unhappy. I suppose from a personal attributes perspective, we're always looking for people to be transparent and honest. And this is me now as a manager. That they're not part of the team, they're a visitor, and they've just got to always remember, as much as they are, they know the people and they've formed some sort of relationships, they're a visitor. And what we mean by that is not to actually try and be like distance or disengaging. It's all about the fact that as a manager, you've got sometimes 60 people on the floor, and you've got to know where all those people are at any one time. You've got to know from a fire perspective, you've got to know from, now we've got COVID, we've got to know where people are coming from. And I mean physically coming from, not just where they're coming from a sales perspective. There's lots more responsibilities on a manager now than there ever have been. And of course, the staff feedback is always around those sorts of soft skills. It's not always around, well, they knew all their bits and bobs, and they had the laser pointer and they knew exactly what I was going to use next. They had it up their sleeve, all that sort of stuff. It's not normally about that. It's how did they actually integrate into that theatre? Were they respectful of people in there? Did they speak to everybody, or did they only speak to the surgeon? Did they drop and run? Did they use the bin? It's always stupid things that actually make a big difference. As I said, there's twofold. It's theatre and CSSD for us. Documentation and paperwork, a lot of the time it's easy for, I guess, the reps and that to understand what they require from an invoicing perspective. Not always not always easy for the theatre staff to understand how things need to be recorded. when we're looking for things like when I'm looking for quotes and stuff, I want the rep to understand our needs. So I want a solution. I don't want to have to explain too much. I want to actually say, this is the problem. This is the current piece of kit I've got. This is what doesn't work about it. And I want them to go away and find me a solution. But I want them to be upfront about what they can actually do and not actually promise me the world and deliver me half of it. I'd rather they under promise and over deliver every single time. And the one the point of exception for me is always going to be the after sales service. Always, always, always. So it's about, you know, what is their commitment? How do they actually show a commitment to that department? Because it's really easy when you're a tertiary referral centre. That's always the sexy surgery. It's always harder when you've got a smaller service, and it might be the biggest operation that they've done, not what the rep's done, but it's the biggest operation they've done, and they want the same service as the tertiary referral centres are gaining. From a hospital and health service perspective, we have behavioural expectations with regards to things like code of conduct. It'd be really good if that rep or that person has actually looked up what the code of conduct looks like. So whether that's New South Wales Health, Queensland Health, whoever, we've all got them. If they have had regular assessments, or what does that look like in their for their company? What does a regular assessment look like, and do they actually reach out to their industry partners to actually even be involved in those assessments? Because again, yes, it's about behaviour, but they might be angels on the phone and they might be angels in the office, but we don't actually know how they go from place to place. And as I said, I've worked in very small centres with 4 to 8 theatres, and at the moment I've currently got 20 on one site, 6 on another, and 6 on another one again. So I'm across 3 hospitals. So I'm looking for the ones that, you know, are treating my smaller hospitals exactly the same as my tertiary referral hospital. That they actually, it was interesting that you actually said you're doing psychometric testing and so forth. I don't think we do enough of that. And I don't think we have a clear understanding of how introverts and extroverts work. I don't think there's enough, what would you say, focus on that. Introverts, you know, particularly when reps are speaking to them, they won't even respond with anything until they've picked the right answer in their mind, or the only answer, because they've eliminated all the rest. Where an extrovert will talk through everything until you say that's the answer, and they go, great, I got it. So I don't think we actually we give that enough focus, and we don't give it enough credence. I think from a company perspective, we need a bit more visibility about the training and the support that the company actually gives those people that are coming into our facilities, whether they do understand the department, whether they actually look at the department and think if that actually marries up with the skills of the rep. Because sometimes when you get trainees into a hospital or a service, the trainee is going to sink straight away because you've got a very strong surgeon or a very strong scrub nurse, or you've got a team that a well-oiled machine, and this rep has got no way of catching or keeping up with them at any way, shape or form. But it could be the complete reverse. The rep could be a well-oiled machine and everybody else in the room's gone to poo. And, you know, it's sometimes the rep can pull it together really easily with a couple of kind words. I think it's really essential that they do that homework, because it's all about being rounded. It's not just about the skill, isn't it? So also from a hospital perspective, we've got gates, like, you know, we call it governance. There's different departments that, you know, there's things that we've got to go through. So again, do your homework, find out whether or not, or if they've done their homework, or they're likely to do their homework about, you know, patient care technology. What is the expectations of that credentialing at that site, because it could be different for different sites. And do you have to sign in every time, or do you think that because you've got that relationship, you don't need to sign in? We like to think that you've signed in. Again, on the floor, we don't have to worry. We don't want to worry about that. Hospitals on the whole, their governance is getting tighter and tighter, and health service all the time are adding in extra layers, unfortunately. We have equipment evaluation committees, we have product review committees, so we have review committees for pieces of kit that are reusable. We have, you know, review systems for consumables that go with those pieces of kit. And if one doesn't relate to the other, or if the rep hasn't done their homework on one for the other, then nothing will be brought in. So we've had times when the consumable is awesome, and it does relate to a piece of kit, but we haven't been able to reprocess the kit, so we use none of it. And as I referred to before, AS487, I think it's probably a good reference if they, and probably something to keep in mind, that they actually should have a working knowledge of that, that standard. So as I said, it's the reprocessing reusable medical device standard, and there's lots of parts in there that if they're importing them from different parts of the world, then they have to understand whether or not in Australia we can actually process to those limits and to those standards, and they may need to be able to interpret them. So from my perspective, they're the people I'd be looking for if they're, you know, able, willing, they acknowledge those sorts of things. Trials are a really big issue in the hospitals at the moment. It's I guess the governance around them is getting tighter and tighter, and it doesn't mean a guaranteed sale, particularly if, you know, the trial's not free, the rep's not there to support, and they're not flexible around that. They don't actually understand that we might have to work through a piece of kit before we can stop using that, or work through all the stock before we use the next lot of stock. And it's about, again, it's that flexibility and adaptability for each site. Can they do that, or do they have a very very strict and what's the word, non-flexible approach to the way they do things? The other thing that we're looking at is everybody's budget's terrible, and COVID's affected us all very, very badly. As you can imagine, you know, there's a lot of businesses that have gone under, and the GST isn't coming into all these government agencies anymore. So, for example, in Queensland, we've been asked to save $4 billion across the public sector. So that's got to come from somewhere. So, you know, there's a less budget for capital expenditure. There's less budget for what we call HTR, which is health technology equipment replacement. So that's a program. And again, every state would have that. So instead of having those options up our sleeve, which we usually have, then we'd be looking to, have we got the right technology? Did they sell us the right thing to be upgraded? Is there sort of a replacement? Is there a piece of kit that can work with our existing on the road to getting new equipment? A lot of hospitals want to have standardization. Is that possible in this light? I think we have to be very realistic, because this isn't just at the moment, this is going to be for the next few years. So from my perspective, it's all like, that is from a clinician, that's from somebody on the floor. They're all the things that we take into consideration. They're all the things that we want to know if a person is flexible and acknowledging and willing to work around all those things. And I would suggest if they're not going to succeed, and you won't sell your kit. But that's my opinion. That's all.
Thank you so much, Sandy. That was, sorry, Casey. Yeah, that was.
I do have one question. I'm so sorry to interrupt, but you touched on it briefly earlier. Just on credentialing, what we're seeing is trends overseas, really kind of, you know, ramping up the more scrutiny on the credentialing and the accreditation of reps before they're able to enter a healthcare facility. Have you noticed similar trends coming into play in Australia?
Absolutely. I think it's a bit scratchy between the different hospitals, and I think it's misleading, because you would think that the tertiary sites are going to have a really good process around that, and it's not often the case. The smaller hospitals, because they haven't got as many people, they can't be everywhere at the right time, so they create the process to try and be the gatekeeper, if you like. So there's lots of, and that's what I was saying before about patient care technology. So one of the hospitals I previously worked in, we had an area called patient care technology, and there was only 2 ladies that worked in it, but they made sure that they had a list of I guess gates that these people had to go through. So they had to actually do all the paperwork, and they had to be on file. They had to have, and there's a course, and I've forgotten the name of it, Casey, I'm really sorry, but there's been courses in the past that industry provides, and they have actually made that as part of the checklist, that they have to do these courses. They give them a copy of our code of conduct as to how they're supposed to conduct themselves in the hospital. They make sure they sign up to a list of expectations, as in you must have an ID tag, and you must have a new ID tag every time you enter the hospital, and you must hand it in on exit, so we know when they enter and exit. Credentialing, I guess, external and then internal. So, we interview them. Again, patient care technology gets feedback from the departments that they go into, and we notify the company back and forth whether or not our industry partners are meeting our needs, one, but also adhering to process. So I think that's really, really important. We've even got to the point where we've had to say to them, it's getting that bad that this person will be black banned. They won't be welcome into the establishment if they don't actually get up to standard, because their behaviour or something is wrong, or they come in after hours, access the theatre, go and get their stock off the shelf to help out another operating theatre. I can give you so many examples of bad behaviour, but somewhere along the line that gets reported. Nowadays there's lots of cameras, so there's camera evidence to say yes, that backs them up. So I think the old days are where they had free access and they were able to do and be their own boss. It's getting more narrow all the time.
Thank you, Sandy. You've given such an incredible kind of broad view with your, the huge area that you look after and your background in nursing and through nursing. So maybe we'll throw some questions out now to the audience for Sandy, if anybody's got any questions. You can unmute. No? Okay, we can always come back to questions at the end. Sandy, I actually have one. You raised a really good point about obviously within the health industry, nurses, doctors, allied health have a lot of credentialing throughout their career. So you're constantly making sure that you're hitting benchmarks and giving the best that you can to the industry. So that was a very interesting point that you raised, that you would like to see that from the industry and get feedback as to what that training is and how it's kind of benchmarked and continually reviewed. Would you say, and I'm sure I probably know, but is it very broad and varied depending on from company to company, or do you see any industry standards anywhere?
It is wide and varied. A lot of the time, when you get friendly with reps, they really do let their guard down, and you do hear about all their sales targets and those sorts of things, what they've got to work to. A lot of the things, when they're bringing in new product and so forth. But what we don't hear about behavioural KPIs or KPIs with regards to other things other than sales targets. We don't hear about quality indicators, whether or not they've actually provided resource. It's not always, for the doctors, it is a lot about papers, but for nurses it's not. It's about education on what are the things made of, where, because we're talking about recycling, we're talking about many things. So they want to know about the items that they're used, or how they're used, how they're sterilised, how they're disposed of. They want to actually understand what the need was, or what they thought the need was. What did they address? Is it still being addressed? How old is the technology? Is it being replaced by something else? One of the things when we buy technology, and I'll use a lap stack for example, is that for a long time the technology remains the same, or the platform remains the same. But they don't often say to us, well, the platform's going to change. Well, we can do you a really good deal on this, this lap stack, say Series 2. We're not always in the know of when Series 3 is coming out, because some places may hold out till Series 3 comes out, but everybody might race in and say, well, Series 2 is good enough for us because we can afford 6 instead of 4. So again, it's about them understanding what the needs of the place is, the almost like the economy of the health service, and whether or not it's actually a rich economy or a poor economy. Are they interested in relifing things, or they may go to another company because the piece of kit that they buy can be upgraded by putting a new chip in it or something like that, as opposed to having to replace it every 10 years.
Yeah, and I think that's right. It's really tailoring the approach to each site, and those companies having a very full understanding of each of the dynamics and commercial dynamics. Absolutely. Within each site. Great. Well, look, Sunny, I'm sure we're going to come back to questions. Sorry.
I was just saying, quality is at the forefront now. So it's just those quality indicators, and looking at the quality of everything behind it. As I said, Australian standards, TGA, and the importance of that. We're getting more and more pressure to make sure all the checks and balances are done, because you don't want to buy something that you can't reprocess. You don't want to buy something that you think it has a limited life, and we really haven't understood what the limited life looks like. 100 sterilizations or something like that. Those sorts of things will affect not just if they buy it now, but if they're not upfront about it, you won't have a relationship ongoing.
Yeah, absolutely. Thank you very much, Sandy. I'm sure there might be some questions. I think you may not be able to stay the full time though, is that right? So if anybody does have anything they want to jump out, don't be shy.
No.
But
that's
thank you.
okay. I said to Casey, like, I can get back to you later on if that's if that's necessary. That's fine.
Fantastic. Thank you so much. Thanks so much for your time, Sandy, and your views and input.
Pleasure.
Now we'll move on to welcoming Richard Thwaite, given that Sandy, you did refer to psychometric testing and that you'd like to see more of that done in the industry. It's a good time to introduce Richard.
Glad to hear that.
Intelligence.
Glad to hear that.
Hi, Richard.
Hi. Yeah, great to be here. Now I've just got a few slides that I've prepared for everyone.
Yeah.
I'm just going to share my screen so everyone should be able to see that now. So just a bit, so my name is Richard. I'm the head of product intelligence. So we're a company who make psychometric assessments and use psychometric assessments with clients all over the world in a range of different industries and from range of different backgrounds. So when people think about psychometrics, they think Myers-Briggs. Many people's minds go straight to Myers-Briggs and kind of the psychometric assessments of old and potentially some not ideal experiences they might have had with them. But psychometrics these days is more than that. So we really conceptualize this as 4 key pillars. So the first of these, psychology has always been a core function of psychometrics, the idea that you are predicting behaviors that are going to result in success. Very, very important. But before, it was done at the expense of everything else, whereas now the world has moved on. So there's still psychology. There's also technology. So the idea that psychometric assessments can be done by anyone, any place, any time on any device is really important, and that's a real hygiene factor in this digital virtual world that we live in today. A third facet that we see really emerging is people using their data as an asset. So the data that you're gathering from your candidates during the recruitment process can be used to really create iterations and iterative benefits on your recruitment process. So looking at making it more scalable, making it more repeatable, and therefore having better results. And the fourth pillar, as we've kind of seen evolve, is design and candidate experience. So when you're using psychometric assessments and measuring these behaviors from your applicants and from your candidates, you want to make sure that's done in a really high quality way. We're demanding high quality digital experiences in the world that we live in, and that extends out to anything that anyone is interacting with. Great. So psychometrics. So why use psychometrics? So psychometrics are really a way to measure someone's personality and measure their abilities before they get in the door and before you've hired them, before you're paying them a salary. And when people are moving through a recruitment process, employers see a few things. They see their skills, they see their experience, they see their knowledge, but there's also a lot that they get that is very hard to uncover through traditional means before you hire someone. So you have their interests, their motivations. You also get their cognitive ability, so how effectively they can solve problems, and then their personality tendencies, their soft skills. Sandy, it was nice to hear you say the importance of soft skills, and I think that really, it's almost as if we'd compared notes beforehand, which we didn't, but it's nice that that's coming through as well. So psychometrics are really important for that objective measurement of all these different capabilities. Not only can you use them to understand how effective an applicant is going to be today, but you can also understand tomorrow and where they're going to go. So what their potential is to grow into the role or to develop in the role. And it's these things together in combination which really allow you to get a handle on the fit of the candidate. So not only where the candidate's going to fit, how the candidate's going to fit with the role, but also with the business, with the team, all reasons where using psychometric assessment early in a recruitment process is really valuable. Now, many people say to us, well, don't we know, I know how to figure out someone's performance. I can look at their CV, I can look at their experience on the job. And one of the ways that we've kind of developed out our tools, and part of the reason that we've got a base of our tools is because of all of the academic research around different selection methods and different ways of bringing people into organizations. So some of those traditional ways of bringing in, looking at job experience and education, academic longitudinal studies have found that they're actually very weak predictors of performance in the job and in future. A lot of your performance is actually measured more effectively by other things. So top of this list are cognitive ability measures. So things that look at how effectively you can solve problems on the job given different kinds of information. And coming a close runner-up is good structured behavioral job interviews. So what we often suggest is that when you're using psychometrics, they're a tool like anything else. They're not a one-stop shop or a magic bullet. They're designed to be used with other measures in a recruitment process. So we see the best results coming when people are using testing, and they're using that alongside interviews and alongside assessment centres, and throwing in some reference checks as well. And that really helps to drill down and understand what the candidate is like, and as a result of that, how effectively they're going to do the job and how effectively they're going to succeed on the job. So this is why psychometrics are useful, and why how assessments are used early on in the process. There's also, there's a lot of questions that we hear. Okay, well, I know these tools are important, but how do I actually use them? Where, at what point what do I do them before? What do I have them after? And so we've really modeled out, through speaking to our clients globally, a number of problems that these tools are used to solve. There's really two key buckets of problems that occur in the hiring process. The first of these is talent sourcing, which is really a quantity problem. So getting enough people into your recruitment funnel so that you can fill all your open roles. The second key bucket of problems is acquisition, and this is really a quality problem. So these people that you've got through and into your pipeline, how do you know who of these is going to be good and who of these is going to be less good and maybe struggle a bit in the role? And that's really where making sure that we're mapping psychometric assessments to the right stage is really critical. So tools such as personality assessment, cognitive assessment, hard skills assessment, looking at different competencies and different behaviors that someone might express on the job, and combining those with technology, different types of technology such as video interview and using digital assessment centers. These are where psychometrics are typically used, and where they're used most of the time to really assess the quality of candidates. We're also seeing some movement and some data being gathered earlier in the process, actually in that talent sourcing stage, and that helps with giving candidates a realistic job preview. And the reason a realistic job preview is super important, some people don't actually realize the realities of the job that they're going for until they've been hired. And in that case, if they're not a good fit with the role, or if it's a bit full on with them, that can lead to really high levels of turnover. So actually putting these tools, putting videos and assessment earlier in the process can help people not only screen into the process and really help you to broaden that funnel, but also to screen out and say, this isn't quite the right fit for me. Also, if anyone's got any questions, by the way, throughout, feel free to just come off mute and pipe up. Happy to take them as they come. So I talked a bit. I mentioned behaviours, and as everyone knows, different behaviours are needed for different jobs. So it's really important to understand what good looks like for your specific job. Typically in psychometrics, there are 3 key things that people do to understand what good looks like. The first is what's called success profiling, where you're really taking data from the job, so from position descriptions, industry research, talking to existing people in the role, and understanding what someone needs to do to succeed in that job. take those competencies or behaviors and design a test. So picking from the test library and understanding what's going to be the best fit. And then the third step is validation and closing that loop. So making sure that everything that you identified in the success profile and designed when you built the assessment is actually coming through, and people who are scoring higher in the test are performing better on the job, and making tweaks if there's any tweaks needed there. And in terms of how you identify that good, that's done through a number of different types of reporting. This reporting is designed to be used both in a pre-hire space, so looking at someone's strengths and areas for development, and I'll go into a bit more detail about different report types later, but also looking at how this data can be used beyond just the recruitment event, and actually looking to see how it can be used on the job. So that means that's where reports such as looking at someone's emotional intelligence, so how effectively they can come into the job and understand the different stakeholders that they'll have to engage with, and actually engaging with them in the right ways. Looking at how resilient and how much grit they have on the job. You know, there's a lot of ways this data can be used on an ongoing basis. Great. So in terms of these success measures that are being identified through the success profiling stage, we do see overlap between different roles. There are competencies and behaviors that generalize quite well across different roles. So I'm going to explore this in the context of 3 buckets that I'm sure many people on this call are familiar with: clinical support sales associates, sales and territory managers, and leadership roles. We've actually distilled this data down into what we call a success matrix. So we've got the roles here along the top, or the buckets of roles along the top, and then the behaviors and competencies down the side. Now I'll make the point that this is not an exhaustive list of everything that is important on the job. There are lots of behaviors that are not captured here. And what we've designed, the way that we design psychometric assessment is really to with the 80-20 rule in mind. So making sure that you're measuring up front what's most important and what's critical for performance on the role. And that's what each of these ticks means, is that this is a behavior that's really going to be predictive of performance and really critical for that performance. These are behaviors that are going to do most of the heavy lifting, rather than saying this is all you need, and if there's a gap here, it's not important. And you can see here, again, Sandy, kind of a few points from your comments that came through really strongly. The ability to build relationships, the ability to communicate. These are things that are common across a whole bunch of different roles, but there are also competencies and skills that are more specific for specific roles. So things like how effectively someone directs action, being really predictive of success in a leadership role, and then kind of everything in between. So competencies shared between across roles. So last few slides, and then I'll open up the floor for any questions that anyone's got. So touching on 3 different types of reporting. So the first being recruitment reporting. Now this really allows you to get a handle on the strengths and the areas for development for a candidate. So getting a high level profile of all the behaviors that you've measured through that success profiling, and then using that data throughout the recruitment process. So to screen, to gain more insight about a candidate, as you can see here, to tailor some of your stages, like asking them probing questions in an interview for behaviors that are particularly an area for development, or changing communication styles for people who may have tendencies in a certain way, and then that being used for onboarding and post-hire as well. So really valuable data that can be used as an asset. Team types. So this is kind of another lens that we see on psychometric results, looking at a team level, looking at a team fit level. So if you're crafting a team, you want that team to have complementary styles. You don't just want a team of people who are really innovative and always looking for new ways to do things, but never get anything done. But on the flip side, you don't want a team of people who are just checking boxes and never think about new ways to approach problems. So you want that balance, and that's how you build successful teams with this data. And the third and final slide that I've got for you on reporting is around leadership. So we often see some of these some of this type of reporting being used at the shortlist stage. So if you've got 2 or 3 candidates who you just can't choose between, and the role is something that is really going to develop into a leadership role, or the candidate is designed to develop into a leader, you can identify that from day one and actually look at those results and select people based on that. You can also look at it again, kind of in a post-hire way after recruitment, and say, well, this candidate over here, some competencies here in this yellow area for development. So let's really put some plans in place to coach those people and make sure they're going to have those necessary skills in place when they need it. Great. And I mean, that's everything that I kind of had prepared, this overview of psychometrics and how it's applied, especially for the this context. So if anyone's got any questions, please feel free.
Richard, Simon Chelpey from Big Green. Just a question. The last 6 months have brought a lot of challenges to
Yes.
every companies, and one thing that sort of shows that people that are more resilient than others, those that can just keep soldier on and keep working through all the challenges. Yes. Is there a way? Is it something? Is that a quality that you actually can measure in the psychometric test?
Absolutely, absolutely. So there's 2 ways that we can measure that. There's a competency called that's specifically designed for resilience, and that looks at kind of people's tendencies. So how composed they are, how well they perform under pressure, how they deal with new and changing information. And there's actually another type of way of measuring this, which is called a grit report. So grit is a concept that's come out of a lady named Angela Duckworth from West Point, and it's this idea that people have a passion and a perseverance, and those are the 2 things that really make resilient workers. So it's definitely something that can be measured, and definitely something that we see linking into performance on the job. Definitely.
Thank you.
Any other questions from anyone for Richard, or about, does anybody use psychometric testing at their companies? Maybe not. Well, we can always, you can always email questions through afterwards as well,
please do.
And we can connect you with the team at Telligent. We actually use these reports for anybody that comes through our academy before they're even interviewing for roles, because we use it really as part of the process and understanding, do they have those things, Simon, like particularly resilience and grit and determination to make it into that kind of sales role, as well as us giving them a full insight into what the hard bits are about our role and that kind of perseverance you're going to need to be successful in this industry. So we've really benefited from partnering with Telligent, and although it doesn't completely inform our decision, it certainly helps. And I think the thing that's so useful for us, which is the development report. So it's not just, this is what you are, therefore you're not going to be good at this job, but it's, here's areas that you can develop and how, and that's really useful.
Yeah, because personality is so context dependent. If you've come from a role where you haven't needed to be a leader, and you really need to grow into that, it can be something that takes a while to develop, and it doesn't mean that you can't develop it.
Exactly, absolutely. Great. Well, thank you so much.
Thank you.
So I might press on, given that we're running a little behind schedule. So it's 1:20 and I know most people have got to be off by 2. Now, Brent and Brodie, I might go over to you, but we do have Dr. Gray joining us, and he's literally joining between rooms through to clinic. So I've had a text, so I may need to kind of break things up if he jumps on and then has to jump off quite quickly. Hopefully that doesn't happen, but let's start with you guys. So thank you both so much for joining us, and it's so interesting to hear from reps working in the field now, and the kind of challenges that you've had entering the industry, learning about the industry through to kind of your everyday and what you're doing now. So maybe I'll start with Brent. Could you just share with the audience what your background is and what your journey into the industry up to this point is?
So I'm a podiatrist in Sydney. I helped manage and run a pretty busy clinic in the CBD. But I guess for myself personally, I sort of felt like I hit that ceiling where, in terms of development, I also got a bit sick of in allied health, like, you get a percentage, or hours can vary, the instability that was around the financial aspect of the profession as well. So I'm just, I was sick of it. I also got sick of patients. I just got sick of trading. So I went and saw a careers coach, actually, and did aptitude testing, personality testing. And through that, they were able to sort of say, okay, these are the roles that are actually well suited to your personality. It's where your strengths lie. And sort of went, I don't really want to go do a trade. I don't want to have to restudy. I'm like, well, what about medical sales? Because that was sales actually quite high up. And I said I quite liked health. And I sort of went, all right, with my background, I like orthopedics. I went into all orthopedics companies. I went and contacted people on LinkedIn, got an idea, and that's how I sort of worked my way into it. Oh, Tara's muted.
Sorry about that. First technical error. Yeah, you are very good, and you've definitely got that kind of grit and determination. You've been on our webinar series all through COVID, and you've actually career transitioned during that time. So I know that you will be a huge success. Maybe Brodie, I'll talk to you because you came from a non-health background. You actually came from a sales background into the industry. What were some of the challenges for you in that kind of first 6 to 12 months about learning all the medical terminology, hospitals, the industry? What were the challenges for you?
Yeah, so there was, being new to the industry, there was quite a few, like, as you know, my career to date being sales focused, but not necessarily clinical. So some of the challenges were now seem fairly sort of straightforward, but at the time, I just wasn't aware. Little things like different departments and areas of hospitals, titles of stakeholders and departments. They can use acronyms for models as well. So just sort of gaining understanding. Also physically navigating my way around.
Brodie, I'm so sorry. I don't know if it's just me, but I can't really hear you. Is everyone else having the same problem? Yeah. Okay. I know
my connection.
Yeah, it could be. Maybe I'll just get you to work on your connection while I go back over to Brent. But I know what you were saying there about when you're first joining, all of the they may seem basic to most of us now, but all the acronyms like CSSD and DON and NUM, and you feel silly asking those questions, And I think certainly when Casey was designing the professional medical device reps course, that's what it runs through, because they're the things that can make you feel so overwhelmed in that first few months, or even longer than a few months. So Brent, what about you? Even though you came from a health background, the industry is still a huge and nuanced industry. What were some of the challenges for you?
I guess some of the challenges were, you not having been in a theatre environment, you've got to learn where you can stand, don't touch anything, the dynamics of a theatre, as well, like your product knowledge. You want to go in there confidently, but trying to juggle all that at times can be quite challenging. So the thing I probably found most difficult was not having a set learning schedule for that my whole team knew about. So you'd be with one rep and they'd be like, why don't you know this? Sort of like, oh, well, he said not to worry about it. And, so that was a challenge. Learning it yourself. You got to be self-motivated. You got to work hard at it. That couldn't be challenging at times if you particularly come from a team. But the biggest challenge I had was just differing people wanting differing things. And every rep works differently. Some things are more important. You just got to work out yourself what is important, what you need to know, what you value, and being able to bring into that theatre.
Yeah, and I certainly know we get a lot of feedback all the time from people in the academy that, or people in the industry, just that it's so different. Like the process is not a standardized process for training as it might be when you become a podiatrist. It's a very kind of stepped out process for learning what to do, whereas it really varies, and the kind of, there's not a lot of standardization. There is in some ways and there isn't in others. So I think those nuances of the kind of tricky things, aren't they? Brodie, sorry, I'll go back to you.
Yeah, I've connected to my hotspot, so is that better?
It's a little bit better. We'll try you one more, and if not, I might have to go over to Brent. So it's a bit
See how we
sloppy.
go.
Yeah.
Is it? Okay. Yeah, and as Brent touched on, although it was very exciting being exposed to the theatre environment, it's still quite daunting at the same time.
Yeah, Brodie, I'm so sorry, just because I don't want to, yeah, we just can't hear what you're saying properly. So I'm going to flick back over to Brent. So Brent, and obviously how long are you now into your career? Because you've moved from a clinical associate role, so where you were doing a lot of theatre time and supporting the sales team, through to a sales role now. So how many months have you been in the industry?
In October, will be 12 months in total.
Yes, okay, so that's quite quick through to a sales role. So what do you think the challenges were for moving more from that kind of clinical support role through to having accountability and responsibility for a territory? Hi, Dr. Gray, I see you there.
Hello.
I think the big thing is knowing, so particularly when you're a clinical, your expectations are, you know the products, learn the products, spend your time doing that. Sorry, someone's at the door. And so learn those products, but you don't get taught those sales skills. So I saw that gap, and I knew that there wasn't that stuff given at my company. So I went and sought that myself, and that's how I was able to bridge that gap quite quickly. So yeah, and the other challenge is sometimes, particularly when you're at a big company, people don't leave. So you're waiting. It's a waiting game. You can be clinical for 2 years because there's no sales roles have come up. So you may have to go elsewhere.
Thank you, Brent. Now, what I might do, Dr. Gray, I know you have a clinic to rush to after this session, so I might switch over to Dr. Gray if that's okay, guys, and maybe, Brodie, we can get your connection fixed, and then we'll come back to the rest in the field. So I'd like to welcome you, Dr. Gray. I know you've had a busy morning, so thanks for joining us.
Yeah, lots of talking. Anyway.
So we've already heard this morning from a nursing executive director. We've had some conversations with our psychometric testing partners that look at good attributes for reps for different roles. So now it'd be great to hear from you, from a surgeon's perspective, you know, really what your expectations of your reps are in theatre.
Thanks, Tara, and thanks for asking me along. I think I'd sort of start with just the territory of spinal implants and implant companies. They're all good, basically, and so what determines what implant I'm going to use or keep, as they put it, keep using, is not so much the technology that it comes with, but the people it comes with. And so the companies that have been and gone are the ones that have had poor service, poor attitude, poor interactions in theatre, either with me or the people I work with. Because if the reps are good to me but are really driving the scrub staff crazy, or the people who are behind the wings, I hear about it. You know, oh, I hope you're not going to use X, Y, and Z company because, you know, there's eye rolling or whatever. And you go, oh, that's interesting because, you know, oh, that rep's never organised, or that, you know, that company drives us crazy. So I hear the comments from the team, from the scrub sister all the way down to the store manager or the sterile supply people about companies that are irritating them because of disorganization or whatever. So that's one comment. The second thing is, for me, it's the service of the rep, making sure that they're organized, they come with what I need, and things are covered, and they're there early, and they're liaising with the scrub staff. They've trained them up, and they've got things together, and so before the curtain lifts, they are as good as they can be organised. And then during the case, a good rep's almost not seen by me or not heard by me because they're watching what's happening they're quiet when they need to be. They can enjoy, engage in conversation when it's appropriate. But what they're doing is helping the scrub sister with what I'm going to need next, and it's done quietly and unobtrusively, and hopefully that when I need something, the scrub sister's not talking to the rep, and that's really hard to balance sometimes. So it's that in theatre behaviour, and frankly, they're part of a team. I mean, I view those company reps as not sales men and women, but an essential part of the team. We need their equipment, we need their expertise and organisation. And then these are long, boring operations often, and so at least for my theatres, I try and keep everyone sort of welcome and at least engaged and let's not say happy, but at least tolerating the situation they find themselves in. So yeah, it's often the personal qualities of the and abilities of the rep rather than the implants that they're marketing that for me keeps me going back to that same company.
And Dr. Gray, we've got a number of people on from varying companies, HR managers, hiring managers that are directly responsible for looking for their next employees. So of the attributes, obviously, like you say, a lot of the implants are actually, they're all very good. So what are the attributes that these hiring managers should be looking for, and also coaching in people to understand the right behaviours in that theatre environment, or to be the best, to be the best support they can possibly be?
I think emotional intelligence is really high on my list there. It's reading the room and knowing what's going on, so that you're quiet when you need to be quiet. There's nothing more irritating than I'm in a very difficult part of the operation, and I'm usually pretty chatty during an operation, but when I go quiet, it means that I'm concentrating on something. And I don't want to hear the other way. These 6'4" footy heads in the back corner trying to chat up my scrubs, my scout nurse. So the people that don't read the room are kind of irritating. People who aren't organised, that just are just a bit lazy. I mean, I plan my operations. I go to the operating theatre knowing what I need, and if everyone else is doing their job, that's great. If people constantly turn up with stuff missing, not on the trays, and I'll talk about a case from us, a revision case on Monday that was good and bad. That really irritates me, because it means that my operation is going to be slower, outcomes might be poorer, and if I don't think that the rep's has the same attitude as me in terms of the patient coming first, that's a bad thing. That's hard to gather. That's hard to recover from for me. Yeah, insight. So knowing what your strengths and limitations are, and being ready to learn. I think just having an openness, and you guys reps have got a hard job. I mean, they're going to all these different environments. They feel like a stranger. Sometimes they're really unwelcome through no fault of their own. So it's not easy. So you've got to have a bit of emotional resilience as well, and be patient to get to where you need to go. So I think, EQ, organisation, intelligence, and seeing yourself as an important part of the team rather than someone who's got a sales target to meet is important as well. So there are some reps who they should be on Parramatta Road selling Audis, really. So, and then there's a certain appearance of some reps. There's the 6'4" footy head, and then there's the swimwear model. And I get why they get picked, but I just don't care what they look like. I just want them to do their job properly. So I think a bit less on appearance and a bit more on ability would be my plea.
I didn't say to anyone you'd be appropriate on this score, so that's absolutely fine. But seriously, can you share, if it's appropriate and not giving any kind of names or anything, but an example of a situation in theatre where the support hasn't been good, and what the impact of that was on maybe you, the team, even the patient, whatever's appropriate to share.
I mean, there's thanks, Charlie. So there's a guy on Monday. This is sort of fresh off the press, and it wasn't a bad thing. It was just like it was. Well, I thought that's typical. That's what I thought. It was an implant system that I'd used many years ago, and it was a revision operation to get this stuff out and replace it with some other implants. The rods had broken, there'd been a non-union, and so that's fine. These things happen. And we ordered the implant removal kit, and so this kit's got screws and hooks in, and rods obviously, and universal clamps, and a whole bunch of different anchor points. And there are hooks at the top of the spine. Let's have the hook holder to get those hooks out. The rep wasn't there, and the hooks the hook removers weren't on the tray. So, you know, I'm doing a revision. They're hard. When I'm taking stuff out, I need the things that take those things out on the tray. And so I think, okay, and this is not the first time. So, you know, everyone goes, that's typical.
Yeah.
And that's why I've stopped using that company many years ago. So that's, what does it do? It irritates me. Can I find an alternative? Yeah, it does. But it means that guy doesn't care what I'm trying to do. That might be an unfair aspersion, but that's the attitude I have. Okay, that's this is your idea of service. I'm glad I'm not using your company anymore. So that's small. Did it cause a disaster? No, it added a few minutes to the operation, but it was a hard operation. It shouldn't be any harder than it has to be, you know. So that's a small example of that sort of stuff.
Yeah. No, that's exactly the sorts of attributes that we're not looking for. It's people that do really care and want to think ahead of all the things that can possibly go wrong and have everything ready. What about an example where, and again, for people looking out for kind of the stars out there, but an example of something where someone really went out of their way and kind of exceeded your expectations from a support perspective, or a company?
It's the people that you can see that they're thinking about it almost the way I think about it. Like what can go wrong? What do I need? And they come with a kitchen sink. And I'm struggling with an implant. I'm trying to get something to fit on the spine, and it won't fit. And the rep will say, "Oh, we've got this new hook or this offset hook, or why don't you try this one?" And it fits like a glove. And often, as a surgeon, or you know, when you're concentrating on something, you get really fixated on trying to get the job done, and you kind of start losing perspective. Yeah. It's really helpful to have someone who's looking on, who knows what to do, and giving you advice. It's hard as a rep though, because you know I could easily throw something at you if I thought you'd crossed a boundary. Not that, you know what I mean? Yeah. So knowing your implants, having that situational awareness to go, oh, look, I'm trying to put a hook in and I'm struggling, and there's another hook holder, or there's another thing that might fit. And that comes with experience. But it's those little things in an operation where I may not be familiar with the entire tray that's there, but you would be. Yeah. Or a well-trained rep should be, an experienced one. And they can start offering alternatives.
Yeah, absolutely. And on that note, and you know, we're hearing, and you obviously weren't with us earlier before, but it's very varied from the rep's perspective in terms of, yes, product training, but also the soft skill training and benchmarks. What's your expectations of what you think companies do, or what they should be doing in terms of onboarding and training new reps, and particularly when they're new to somebody's theatre?
They've got to be really well trained. I mean, they're coming into a really high stakes environment, and you don't want to be turning up with partly prepared. You can't be, because if you turn up like that, you're going to have a bad day at work, because you'll have expectations that you can't meet. They'll have expectations that you can't meet, and that might be you might have one chance to impress the surgeon. It might be a new piece of kit that they're trying, or it's a company that's on the margins of keeping that surgeon happy, and you just tip them over the edge, one way or the other. So you've got to be well trained and prepared when you come into that room, and ready to help. So being organised is critical. Having the right sort of attitude is critical.
Absolutely. Thank you so much, Dr. Gray. I might just open it up to see if anyone or even either of the reps have any questions for Dr. Gray while we've got you here before you have to dash off. Any
Yeah,
questions?
happy for questions.
Any questions from anyone?
Nothing.
We've got a quiet group today. No questions? Okay, well, look, I appreciate so much you joining us in the middle of a very hectic day, Dr. Gray.
Pleasure.
Thank you ever so much.
Pleasure, Tara.
And I may follow up with some emails if anybody had anything to ask at the end of the session today.
Yeah, that'd be fine. If there's any sort of email, if there's questions that just can't be spoken out loud, just email.
And it might be that situation.
Okay.
We don't know who's on the line.
Bye, everybody.
Thank you so
Thanks.
much.
Cheers.
Bye. Excellent. Okay, so we've got about 15 minutes left. So I'm just going to go back to the guys, to Brent, well, maybe to Brent and Brodie, if your connection's working well. So we just were finishing off talking about, you know, the challenges from moving to clinical support to sales. So that's great. Thanks for explaining that, Brent. Now, in terms of what do you think things that companies have done or your hiring managers or HR have done that has supported you and has enabled you to kind of go through this career progression and learning? What's been good?
Two companies I've worked at, the HR onboarding has been like spot on. The day I've started, laptop, phone, everything's ready to go. You're enrolled in courses to learn the policies, everything like that is phenomenal. I know when I moved up here to Brisbane, middle of COVID, they careered me a laptop, they careered me models, they careered me all these things so I could start working during isolation, which was great. The biggest thing I would say, it is product training. Like there are some companies that are known, you just don't do it. You literally learn on the job. You're expected day one to go out and cover cases. And, you know, it's quite daunting. And if you make a mistake, it can affect your confidence long-term going forward. So I think it is one of those things is having that sort of set, all right, this is your time when we expect you to be able to cover this case. By this time in your role, you should be able to cover these sort of cases. But I think that comes more from a management perspective than it does so much HR, I guess.
Yeah, absolutely. And is there anything that you think then could be kind of, again, I go back to this standardization, but anything that could be done better now with your experience or more standardized?
I mean, I'd be a big fan of, I think, if every company, every rep had to meet a certain requirement. So if you're an orthopedic rep and you want to work in a certain area, you need to pass an exam on anatomy. You need to, you know, pass a set exam on this aspect. I'm a big fan for it because I think it'll just make the quality that you have out there helping your surgeons so much better. So
absolutely.
If they can do it.
Yeah, totally. And Brodie, how about you? Is there anything that has really helped you during your time and onboarding?
So Jessica kindly suggested it might be my microphone. So I've now connected my headphones. Is that better? No?
Still so fuzzy. I feel so bad. You've been here the whole time and I know you've got lots to say, but just try one more time.
So yeah, well, the question was, you've done better.
Yeah, is there anything that could have really helped you during your onboarding process?
I think not having come from the industry, I think having like a preliminary course or some sort of industry-specific education really.
Yeah, I'll just say that out because I think Brodie, it is a bit quiet. Sorry, but I think he was just saying again, if there was some kind of pre-industry course or learning that you could have done that would have given you that overview before you even started in the industry. And I know actually, because we obviously only launched a course beginning of this year or end of last year, but your manager specifically, who I used to work with years ago, saw it and said, oh, I wish I had this at the beginning because there's just all those mistakes you wouldn't make, would you? So thank you ever so much, Brodie and Brent. Are there any questions from the audience for the reps and territory managers we have on the line? No? Well, thank you ever so much, guys. Really appreciate your time. And now we're just at the right time. So I'd like to welcome Nick Beecroft from Odro, who is our video technology platform partner. And he's dialing in. What time is it there in the UK, Nick?
It's 4:45 in the morning.
You're very committed to the Australian cause. Thank you so much.
Don't worry about it. Do you know, give me 1 second because my camera keeps cutting off.
No
Can I just, I'm going to leave and I'm going to rejoin. So just give me 1 second, okay?
Absolutely, absolutely, no problem.
Yeah, dedication to the cause.
I know, right? Absolutely, Richard. Dedication to the cause for sure. What we'll do after this, because, you know, I appreciate that there's, you know, lots of different people, lots of different companies, and we'll share the webinar, and then you can, if there's anything specific or anyone you wanted to be kind of connected with, we can always do that via email as well. So that's easy. There you go, Nick, you're there.
Perfect. There's irony in the guy who's supposed to know about video having video issues, isn't there?
Maybe it's because we're using Zoom.
Zoom is saying that it's not detecting my camera, so
Oh, don't worry, we can hear you.
I may have to I'll come back and forth. But I'll do my bit.
No problem.
How are you guys?
Good, really good, thank you, Nick. We're coming towards the end of the session, so thank you for joining us. We've heard from reps in the field, we've heard from our surgeon and nursing customers, and also from our partners in psychometric testing, Taligent. So look, it's great to have you on the line. Not everybody on here will know about Odro or what you do, but it's something that we've found very useful in our processes. So maybe you could just share a bit about what Odro is and what you do.
Yeah, absolutely. So Odro, we are video technology specifically for the recruitment process. So what we are is video engagement and video technology. Our customers will typically use Odro as an innovative approach and a value add to cut time to hire to actually get to the passive candidates that the recruiters are always talking about, and actually approach these people in a way that 95% of the market isn't. So our customers will use our technology to offer a value added service in order to ensure, as I say, cut time to hire stronger caliber candidates, more information earlier in the process, to ensure that when human touch happens, it's valuable human touch.
Yeah, absolutely. And in terms, obviously you're a UK company, but what's your kind of market share and reach in Australia?
Look, we have customers across the recruitment sector, but within the medical device, specifically, you guys are our only customer. You're flying the flag. What we've typically seen is that those who are innovative enough to join at the early part of the curve are typically those who go on to do good things and take a decent market share, which kind of, you know, so yeah, you guys are absolutely pushing ahead in your marketplace.
And in terms of our clients, so the medical device companies, what's the advantage to them of us using this kind of video technology, and what do your other clients say are the advantages?
Yeah, so it comes in a number of ways, right? So the platform is built up on 5 different tools, if you like, all built around video. Each of them have a different value to the recruiter, but each of them have different value to the end user and the customer. So things such as, we know through the last 2 years of data looking at our customer base that a client is more likely to, is 70% more likely to find the candidate that they want by using Odro as the first interview process. And the reason for that is because, as I said previously, what you're going to receive is more information earlier, rather than a generic sort of CV or resume that can be manipulated and doctored by anyone at any point in the process. You're getting a more valuable asset in video to make a more informed decision earlier. What we also know is that the average, if we just look at LinkedIn, right? So you guys have, Casey, Tara, you know, we've had this conversation prior, but you guys have a healthy, really strong network of industry relevant people, right, on LinkedIn, that you guys are always trying to push forward with, give information to, make sure you know where they are, you know, make sure they know where you are, which is what I guess a valuable recruitment partner does. And what we know is that video on LinkedIn will receive on average upwards of 12,000 views per post in comparison to a standard text-based message, which would receive on average between 700 and 1,200 views. And what we have and what you guys have access to is a part of the platform that allows you to post branded. Sorry, I cut off there for a second. What we've got is the ability to create branded content that can be posted immediately to the people in your network that need to see it, and you can start pushing out further into your network so that your messages for your client is being seen much earlier and much sooner to drive those people back. Does that make sense?
Absolutely. I think what we've found, we didn't used to use this technology, and post-COVID we have, A, for interviewing, but B, we've found when we post jobs via video rather than just a standard post, where we can really kind of talk about the company that we're working with and the kind of value and the cultures, we get so much engagement. Like, it's just incredible. We have a huge LinkedIn network, but even within that network, I think video just engages people so much better nowadays.
Yeah, absolutely.
And what about with like the...
Sorry, they're just...
Yeah, sorry.
Oh, sorry. Sorry. I was saying, and even with the ability to use Odro Capture, the plugin that you guys have, what that's allowing you to do is not just post socially, but also more targeted. So the ability to find someone's profile, for example, that's relevant to the need that you want to discuss something with, you can then obviously post, send them a direct embedded video message right through any means that you want, whether it's through Instagram, whether it's through iMessage, LinkedIn, Gmail, Outlook, it doesn't matter. It allows you a more targeted, personalized approach, because we all know that there are a lot of messages going out to the same people every single day. Absolutely. And how are you going to ensure that when they speak to, you're going to do something different and offer more value?
Yeah. And Nick, I know you've talked about in the UK particularly, or maybe it's in Australia too, but obviously with everything that's been happening in the last few months, a lot of companies have headcount freezes, and you've told me about a couple of good initiatives that people have actually used the Odro platform for to keep a good talent pool and community engaged with the client. So what's some of the ways that people have done that?
There's a few really good ways that we've observed and we've seen our customers do it. Things like almost what we're doing now, right? So things like bringing the marketplace together and a kind of webinar type situation where you're using your video tech to bring people together to discuss the times and how we're all pushing forward as an industry. It's really about offering more value, is how we've seen people do that. We've even seen people, like, one of the toughest things that we've seen is people, yes, some people are making hires, but then the issue that you have is that people are getting cold feet and they're worried about the current situation, and how do we ensure that they actually do move from the position they're in to the position that you want them to be in, i.e. the role that they're going to. Well, there's really innovative ways people are using the platform. For example, they're getting in touch with the candidates and they're using parts of our platform to record videos with the team, to introduce them to who people are, to to show, like, we've actually set your desk up, we're really looking forward to getting you started, here we are. And it's about continually building that relationship that you can't do when you can't meet face to face, or you're across state, or whatever that might look like, to try and ensure that everyone is continually engaged from the point of offer to the point of start. There's loads of ways that people have been really, really innovative, actually.
Yeah, I think that's great. And I think I remember you telling me an example of where they didn't have headcount till September, but they'd found the person that they wanted in July, and that person also really wanted the role. So I think every 2 weeks or something in the Odro room, the recruiter would bring together the hiring manager and the new employee, and they'd catch up for coffee or a beer and just keep that connection, so that by the time they're starting, which will be next month, they already really feel very engaged in that company culture and are looking forward to things and haven't gone elsewhere.
Yeah, it's been really interesting to see actually how people have just completely flipped onto video and seen the value of it in the last 6 months, because we've had no choice.
I can imagine. It's become a necessity, really, hasn't it? So
yeah, absolutely.
Absolutely. And in terms of for the candidates, we obviously have things that we find the candidates really enjoy about having a video platform, in terms of when we send CVs to the hiring managers, we're not just sending a CV and a quick phone call, but it's quite mapped out. So it'll be the Taligent report from Richard and his team. We'll send the video link from you guys, which is of the candidate answering some questions, a few key questions. So you're almost getting like a 3D CV rather than just this flat piece of paper where they all look the same. What other kind of advantages have there been for the candidates?
Look, I think one of the key benefits for the candidate is that, one, what they've got the ability to do is bring the right information to the forefront earlier. You know, it's okay, we can run loads of interview processes, but I don't think that values the process. I think what we can do is we can bring, by working together, which is what we should be doing, right? By working together, what we can do is get the right information earlier, and we can bring that to the forefront at the same point that we're doing everything that Richard's team do, that our team do, that your team do, and just present more information, right? Like, data doesn't lie in that respect, and what we know is from our data is that people make more placements earlier, and people hire the people and don't waste time interviewing candidates that they would never hire.
Yeah.
By introducing something like video.
Yeah, I think that's absolutely right. And I think what we often do is with the clients that we work with, we'll get their coffee questions. So when they have that initial coffee meeting, particularly during COVID, we had to, you know, what are those typical coffee questions you ask? So by the time we're sending our shortlist, they, rather than need to see 8 people, they already know it's between 2 people. And so for everybody, that's just been a better process and wasted less time, I think. So yeah, that's great. Thank you, Nick. Now, we've got 2 minutes. So any questions from the remaining audience? It's been a long one today. Any insights or anything anybody wants to ask or share?
I just want to thank you for inviting me and for really putting up this whole webinar. It's timely, it's appropriate, and it's relevant. So well done, and thank you to all the speakers that have been here. It's just been tremendous. So yeah, well
Thank
done.
you so much, Simon. That's lovely. Thank you for being here. And we really appreciate, we know that an hour and a half is super long. We've never done a long one like this before. It's the middle of people's day. Everybody's busy. So really appreciate you all being here, and we'll follow up over the next week and send the link to the webinar app if you'd like to share it with anybody. So thank you to all of our guest speakers, everybody that's been here today, and we'll see you all soon.
Thank you so much.
Thanks very much, guys.
Guys.
Just going back to bed.
Thank you,
See you later.
everybody.
See ya.
Cheers. See you.
Bye.
Bye.